I'm Dr. Vicki Haywood Doe of Vicki Doe Fitness, and today I'm thrilled because we have with us Dr. Levin, a distinguished professor in the Department of Psychiatry at Case Western Reserve University. She's a licensed clinical psychologist at the University Hospitals Cleveland Medical Center and a key leader of the Behavioral Health Research Group at Case Western Reserve University. Dr. Levin's her work focuses on advising our understanding of mental health through innovative research. Until today, we're going to delve into the significance of this research and how it shapes our approach, to health and mental well-being. All right. So, Dr. Levin, what's going on? And thank you for joining us today. How are you today?
I'm great. Thanks for having me on, Dr. Doe. Appreciate your taking the time to talk about research, clinical research generally, and specifically about behavioral health research.
All right. So let's start with this then. Can you share with us why behavioral health research is so crucial in today's society, and particularly in relations to common mental health challenges that we have?
Well, I think that we're becoming increasingly aware of the relationship between mental health, physical health, and wellness. And it works in both a positive and negative direction, so that people who are struggling with significant mental health concerns, symptoms, and conditions like clinical depression or bipolar disorder, schizophrenia, they have an increased risk in developing chronic health conditions. It's really very serious. It affects their longevity. It affects their quality of life. And, um, and the opposite is true, that we find that people who are engaging in healthy behaviors not only improve their physical health, but they also improve their mental health. So if I can give you an example, we
Yes.
all know, I think we all are aware that if we're more physically active, it's good for us in many ways. It helps with our heart health, it helps with our motivation and our energy, and it helps with our mood.
Yes.
The problem is that it's hard for people both to get started with exercise and stay with it on a consistent basis. So here we are, we're in January, and we all have a really positive mindset. I'm going to get started, go to the gym. It's really a good time to get involved, but what's really hard is keeping it going. Things get in the way. We get sick. There's a pandemic. We have a problem with daycare, and then we get out of the habit. And what's really important for our physical and mental health is to really stick with these healthy behaviors long term. And if it was that easy, we would just all be doing it, right?
Yes. Yes.
So we need to find ways that speak to different types of people, because we have all different types of barriers and we have all different things that motivate. People are motivated by different things. And we need to really reach people so that we're all on the same playing field. We all deserve to feel better and to have access to effective treatments. And that's why we're doing the work that we're doing.
All right. And so we thank you. Let's say that we thank you for all the work that you and your team are doing there. And your team, what's the name so that we'll know? What is it?
It's the Behavioral Health Research Group.
So
And we,
the Behavior Health Research Group, and this is at Case Western Reserve University.
yes, we're affiliated with Case Western Reserve University, as well as
Oh,
University Hospitals Cleveland Medical Center.
all right. Well, let's look. Let's take a look. When we talk about, because I did look it up, I saw all of the research that you guys have published and that you're doing. And so your work in behavior health research is groundbreaking. And so, how does this research directly impact both the treatment and the perception of mental health conditions in the general public, for all of us in the community? How does it impact us?
Well, I think what we're attempting to do is find the most effective treatments. Like I said, it's not the same for everybody. We want to find the effective treatments, and we want to get it out to the people that need them, which is not that easy. I think there's a lot more awareness now that it's okay to talk about, open up about, and acknowledge that you're having some mental health challenges. But we actually have an access problem, so that the more people who open up, there's not always providers available to help them. And not everyone has access. Some people live in rural areas, and there isn't as much access. So not only do we need to find the most up-to-date effective treatments, but we need to find ways to get it out to people. Maybe that might be in the form of an app on your phone, or a remote treatment, so that everybody can really have access to, I'm going to use evidence-based care, which means you don't want to just get to, let's say, therapy. You want to get to therapy that has been evaluated through research, right? And we
Yes,
also want to make sure that the people who we tested that same therapy on are the same people who are going to get the treatment. Because the problem is that not everybody has been historically involved with research. We have a lot of groups that are underrepresented. And if they are not involved in the research, then we don't know that those treatments work well for them. And we really need to make sure that everybody has access to treatment that is the best for them.
I do agree. And I also have heard, and from some of my colleagues as well, that are treating and in behavioral health, with telehealth, that has made it even better for those that worry about whether someone will know that they're going to the hospital or going to behavioral, health therapy or what have you. They don't want their friends to know, but it's much, much easier if they can just go on their phone and talk to their psychologist right there on their phone, So I think with technology, this is a good example where technology is helping us to do good care.
I do agree, but I also think that we have to figure out again, is it as effective, so for example, we're trying to translate some of the most effective treatments to apps on your phone. If that will work, it's not intrusive, nobody has to know about it. There's some real great benefits, but I've downloaded some apps on my phone where I'm very excited at the beginning, and I log everything, and I'm very engaged, and slowly we kind of put it to the side. Which is a little bit different than if you're going in person to see
Mhm.
a clinician. You're much more likely to stay engaged with that appointment, although there are drawbacks, difficult to get there, might not have transportation, right? So
Yeah.
what we're really trying to find out is maybe what's the minimal treatment that a person needs. Some people don't need uh,
Okay.
the full smorgasbord, and some people do,
Okay.
right?
Yeah. So that makes sense. So I guess it's back to, like we always say, it's personalized individual care.
That's what we're trying to go for. Yes.
Yeah. Because
Not,
everybody's
not the
different.
same thing. That's right. Not the same thing works for everybody.
Exactly. So, could you tell us about some of the current clinical research trials that you and your team, you are conducting, and how can interested individuals find more information or even become involved in these studies? Because that's what we do want folks to participate in, some of your clinical trials. So how can people, get involved with that and tell us about them?
Okay, well, thanks for asking. How do you find out about all our studies? We have a number of different social media platforms. We have a page on Facebook and Instagram. We have a website at Case Western Reserve University. So if you Google Behavioral Health Research Group with Case Western Reserve University, you will find our page. And we also have a number. I think, Dr. Doe, you're going to put it on here so that everybody knows the 888-819-0004. So if you're just not sure, and you give that, if you call that number, and they'll ask you a few questions about yourself, and you can find out if you might be appropriate for any of our studies.
Okay. So in closing, then I would say, Dr. Levin, look, you need to let us know what we can do today, but also tell us and encourage us, because I'm kind of hesitant myself in participating in clinical research, but just tell us in summary. I would want you to tell us out there in summary why we should at least think about it and go to the website and at least call someone and find out, because I think it's just would be a great service that all of us could do if we could take the time and participate in clinical research, most especially now because you guys have ways where we don't have to always come in person. We can do it, online and all of that. So just encourage
Okay,
us.
so I want to address a couple of things that you said. So one is that many of these studies are completely remote, so that you can do them from your home from the beginning to the end. In fact, most of them are. If you prefer to come in person, we can accommodate you, but you can do all the study procedures from home. The other thing I want to talk about is you said that there are many people who are hesitant to participation research, and I want to address. I think that a lot of people feel like they're a guinea pig, and we're going to do these experiments on them. I want to emphasize a few things. One is that there is a regulatory body. It's called the Institutional Review Board. And there is one at every hospital, university, or if a hospital doesn't have one, then they affiliate with one, because you cannot do clinical research without having this board oversee everything that you're doing. The benefits have to outweigh the risks, and this board their sole purpose is to make sure that we're protecting people participating in research. So somebody is looking out for you. They're not just letting researchers do whatever they want. That's one thing. The second thing is this research process is very long. And before we start, we talk to the people that are affected by the various conditions, and we ask them, what is important to you? And what's getting in your way, let's say, of taking your medication. We also talk to people after they have participated in the study, and we ask them, what worked for you, what didn't work, what made you feel more or less comfortable. If you are a part of a study, you are a part of the solution, and people like you are part of a solution. So like I mentioned before, there are some unrepresented groups who really typically were not involved in research. It's crucial that they're involved in research. Otherwise, somebody who is underrepresented will not have the option that I have the option of these treatments that were tested on people that don't look like me. So we are really, really, it's not just a suggestion, it's a requirement that we look for, include diverse individuals in our studies. And that what that means, it's racial diversity, it's ethnic diversity, but other things, so that really the treatments apply to everyone. We need to know what works for whom and when. It's a tall order. The other thing I want you to know about our research group, and probably others, is it's very warm and inviting. So that when you go to the doctor, sometimes you feel like they don't have time for you. And, if you miss your appointment, they're very angry with you. In clinical research, we are very welcoming, because, you are helping us. And you are helping move the field forward. And so, we're very flexible. And if you need to change your appointment, you can change your appointment. If we find that you're having some problems, we work with people with mental health conditions and chronic health conditions. If we find, for example, that your blood pressure is very high, we will help you get in to see your doctor. We will connect you with resources if you are distressed. So there's really kind of extra supports built in. And then, of course, the treatments that we're evaluating, these are all behavioral treatments, so they're not medication treatments. We've worked really hard and are hoping that they will be helpful. But even if the specific intervention is not helpful, the environment and the warmth that you receive, we have gotten feedback that itself has been a positive experience for people. Did I
Well,
convince you?
yes, this is great. And I'm so glad that you have, Dr. Jennifer Levin, you have taken the time to come and share with us the importance of clinical research, most especially behavioral health research, but also its importance. You've shared with us the importance and benefits of us participating in clinical research. So thank you very much.
Thank you, Dr. Doe.